for being back in the room. Hopefully you had a chance to caffeinate and hopefully you had a chance to meet each other and hear about the interesting work each of you is undertaking. I do not actually have the clicker for the slides, but we're thrilled to start off our afternoon here with a fireside chat. How many of you are new to the room from the previous session? Yeah? Okay. So let me start, if we can go to the next slide, please. I want to just first introduce Dahlberg so you'll know who you'll see at the front of the room. My name is Laura Herman, and I'm a partner with Dahlberg Advisors. We're the largest consultancy in the world that focuses exclusively on social impact. We believe the private sector has a large role to play in social change. And I help lead our global practice around responsible business. And I've been working in global health for 25 years, which is why I'm thrilled that we're going to have a chance to have today's conversation. Next slide, please. We all know that the health challenges that all of you undoubtedly work on cannot be solved by one organization or even one sector alone. And so Dahlberg works across a range of sectors. You can see dozens of logos here, whether there are philanthropic clients and partners, bilateral donors, the various agencies across the UN, governments directly. We're about a 500 plus person shop, and most of our teams sit in Africa and South Asia. So we do work directly with a lot of our government partners. But the private sector, I'm sorry they're on the bottom of the screen for Davos, but they are a huge part of our belief in terms of how change can happen. Many of you will think of this as, maybe you think of sort of philanthropy and CSR. In fact, we think the core of business can be directed towards social problems. We think that there is profit with purpose. There is profit that doesn't have to be profit maximizing every time. We think there are long-term investments that many companies make that are essential to advancing health. And we love to celebrate and support that. Next slide, please. I mentioned our footprint, small teams in US and Europe, but most of our teams sitting in the Global South, supporting those clients. And health is our largest practice area. So across all the issues, whether it's gender equity and water, or access to energy, or climate, health is where we do the majority of our business. So I'd love to introduce our second session here. We're moving from the first set of conversations that started a little more, I won't say esoteric because we had lots of great specific examples, but looking at the geopolitics around all the disruptions of the last 12 months, looking at the role of financing and how do we respond to the volatility that is really the new norm in our field. And now turning towards, I mean, you all knew AI would be on the list here somewhere, but talking really specifically about innovation and the role of AI in that innovation. So that's where our afternoon will focus. And then we look forward to welcoming Dr. Tedros from the World Health Organization to help us wrap up. So to begin our afternoon discussion, I'm thrilled to welcome Alex to the stage. Please do click on the QR code so that you can read his bio, because it is not often that you find someone who can bring a clinical experience, academic experience, private sector experience, philanthropic experience, all to the stage when we think about innovation and AI. And I think we'd love to start today with a recognition that our health systems are under strain. You think about the trends in population curves, just by the aging trends alone, the health systems are being asked to do more and more. And we're probably never going to have enough doctors and nurses to meet this demand. And so we also will probably never have enough hospital beds. And so one of the big provocations is, well, how does AI help us kind of decentralize care? How do we think beyond our current models of clinical settings to something that is more supported both on the patient side and on the practitioner side to broaden access to healthcare? So I'd love to start, because there's a lot of excitement around AI-enabled care, especially when it comes to going beyond some of the traditional settings. But Alex, can we start by a really big picture question? If our mental models are anchored in facility-centered care, this doctor-patient relationship as it has historically looked, does that model allow us to take advantage of the innovation that AI might bring, or is there a fundamental starting point that's different from the tech?
Thanks, Laura. Hi, everyone. Happy to be here. I think this is a great question, because I was usually with these panels, I was expecting the first question will be, right, where can AI help, right? But I look at this issue a bit more macro level. Just like you said, I think across all geographies, no matter where you go, if you just look at the demand and supply gap, it's not shrinking, it's widening. Especially, I think it's a good panel afterward about talking about fertility. People are also not having kids in places where we need to have kids, where the population is aging. So with this as a backdrop, and largely across the world, the health system is built upon a very paternalistic model, where you have central facilities, where there's actually clinics or hospitals, where when you're sick, you come in, we look after you, and there you go again. I think there's a big push in recent years towards more preventive, more primary care, but I think that investment is still a very, very slow single-digit percentage, right, of the entire health system spend. Now, with all of the issues that we discussed, hoping that this new sexy tool called AI will come in, will magically solve all of that, I think is not appropriate, and I think is that the mindset needs to change. And I think the level set of the mindset needs to change is not how will AI improve or solve our existing problem, whether it's actually access, quality, or cost, right? But fundamentally, where can we redesign the health system now with our better understanding of AI? Now, I think if you talk to people 3 years ago when the latest version of generative AI first came along, people were still a bit weary. They're still, oh, what is this really about? What can it do? What can it not do? Now, I think the last few years we've went through a lot of ups and downs of understanding the technology, underwhelming in its delivery, and then another model comes in, right? We have high expectation again. I think the volatility of this expectation and delivery has narrowed to a point where I think most can now say that, look, maybe I know how to actually handle this new thing called AI. And the mindset needs to be, well, rather than just plugging it into the existing faulty system, is, well, how would this change, not only in the delivery of care, but also on the prevention of care, on behavioral changes, on medical education, on public awareness education, right? I see it as a very strong, powerful tool on the whole spectrum of healthcare. And not sometimes we tend to focus very, very much, right, on a very siloed vertical piece.
Yeah. Are there examples of where you're starting to see that shift, where we see AI stepping in amidst a new perspective on how the technology can support the system more broadly?
Well, I think it's not because the health system is choosing to use AI. I think the patients and family are using AI without, quote unquote, I have to say, the permission of the doctors, of the nurses, of the system. Like you see it in all the research on how people are using ChatGPT for healthcare. I myself in China, we also have very, very similar statistics. Like we are more alike in our quest for health than what others will make us believe. And I think this is where the health system and a lot of doctors get very, very jittery about. What if they get the wrong information? What if they follow the wrong advice? Right? What if there's hallucination? Has the model been validated? Is it being scientifically tested? Has it had the latest information? Does it know the local guideline? Right? I think it's right for the health system and doctors to ask a lot of the questions. I tell you a little bit of story. I myself, in my clinical days, went through the similar emotions when the internet and Google first came along. I will have patients printing out leaflets, right, of websites. They say, "Doc, I think I have this. Doc, I think I need this." Right? My first instinctive reaction at that time was that, how dare you question my authority? I went to medical school for so many years. I worked so hard in my residency, right? I got all these letters behind my name. And here you are, you come to my clinic and you took a printout of a Google search result of a website. And and question my judgment. But after a while, maybe it's with age, I mellowed. I start to see it. Actually, this is actually the best patient I could ever ask for. This patient is taking his or own health into their own hands. Versus some other patient who are very, very quote-unquote obedient, will say yes to what I tell them, but might not necessarily do what I advise them to do. Like, you should take the medication regularly, but they don't. And so I think with that, I think it changed my perspective, right? In some way, well, we should embrace curiosity. We should embrace the individuals and families taking more ownership, because in the paternalistic healthcare system, it's very hard for people to do it. I think people now are doing it not because out of volition, but because out of desperation, which I don't think is the right incentive, but nonetheless, the outcome is acceptable. And then I think now the question is, well, how can we make sure they do it in a safe place and with the right guardrails? And I think this is where I have to say the tech sector we are not doing ourselves justice, because I don't think we are having the right sort of conversations together with health. Coming from a tech company, we always like to think that we move fast and break things. We know better. We are more accurate. We can run faster than you. We can be more accurate than you. But I think that level of hubris doesn't do well in terms of the overall integration of adoption. Yeah. At the end of the day, healthcare is regulated, whether you like it or not. The ChatGPT will not write your prescription. Right, the ChatGPT cannot do your surgery on the cloud, right. And I think that's that to me, right, is we are already seeing tangible, not because of the health system driving it, the population is already demanding it. I think the big I will say unpromised expectation is that the AI will be able to solve a lot of your health problem, including diagnosing what I have more accurately than what the doctors have. Let me give you a very concrete examples. If the issue is the AI doesn't understand you, the AI understands in general, at a population level, when somebody has this pain, has this symptom, has this signs, right, with probability, right? This is the most likely diagnosis and treatment plan, but that AI doesn't know you. And I think this is actually the biggest gap right now. Now, even if the AI, quote unquote, right now does know you because you have uploaded your clinical records, you've uploaded your latest test results, but understanding biology and what's wrong with you when you're sick or what you need in terms of prevention is sometimes even a little bit personalized. And there are local nuances that sometimes need to be taken into account where the AI might not know. So I think there's still a lot of deficiency in what the AI says. I think knowing those deficiency is important, because I think this is where progress can be made. But I think if we all believe that there's a savior model, right, that can replace all healthcare, right, which I think sometimes we do see people think that it will be. A classic example, when DeepMind launched AlphaFold, right, it cracked open, it won the Nobel Prize, right? People immediately think that, oh, now I can just create drugs with a flick of a finger, right? Drug development doesn't cost any. No, it's still very hard. It's still very expensive. It's just a very, very useful tool that solves a lot of very difficult questions, but it doesn't solve the entire equation. And I think this is where the expectation is very, very difficult to be met. And I think those expectation is, like I said before, right, I think it's driven by a lot of desperation.
So if we move from some of these big kind of meta questions around AI and healthcare and really think about the point that the opportunity for more decentralized care and delivering care outside of a clinical setting, what are the clinical or care-related tasks that you think could be delivered in a patient's home that could be safely shifted maybe onto the patients themselves? Where would you start when you think about that transition?
Well, I think the first one I would do is behavioral modifications and nudges. I think those are very, very safe vis-a-vis like chronic disease management, right? There are things where the AI, right, can help you to remind you to go for a follow-up visit, remind you to take the medication you're supposed to do, right? When you are eating, you take a picture, right, and say, well, this looks a bit too salty, right? You have a picture. I think these are all very, very useful, safe. Now, it will not solve the issue, but I think it provides a good, what I think, sometimes I was just having a discussion with the WHO, right? It almost feels like you're having a good uncle next to you or good auntie next to you, right? They nag, they tell you, oh, you shouldn't be eating this, right? Let me give you warm soup, right? But it's the care of love that you sort of like keep on being reminded, right, what you should do. Now, I think people will still take their own action, but then having that warm fuzzy nudge next to you as I wouldn't call it co-pilot, because co-pilot assumes that you didn't know exactly what you're doing. I think most people, even me as a doctor, right, I'm also a patient, right? Sometimes I also question myself, why am I doing this? I shouldn't be doing this, but I am. We're humans after all. And I think this is where AI, I think, is very, very safe, right? I think AI can absolutely do it, but because it's not replacing existing ones, right? I think this is where I think the second one, which I think is it allows us to be more curious, to have a lot of conversations with the AI, so that we're much more well-informed when we visit the physicians. And I think this is actually incredibly important because there are numerous statistics and studies to show that most people forget pretty much 80% of what the doctors tell them 30 minutes after they leave the doctor's office, right? Partly because the information is too overwhelming to most people. And so having the ability to continue to actually chat to an AI, to understand it, to ask the really embarrassing dumb questions, I think is probably an area where AI can provide a lot of value, and that value is manifested in a much more focused and beneficial doctor-patient relationship or clinician-patient relationship, so that the patient are not as frustrated because they are bombarded by a lot of terms, a lot of explanation that they may not understand. But at the same time, if there are any other queries, the AI is there to actually support you. So I think this is where the in and out of the non-regulated part, right, which I think AI can provide a lot of good that no one could ever imagine is possible even a few years ago.
And if we go beyond the behavioral side, and even I love your last example of sort of what stays with you when you leave the doctor's office, what from a monitoring or sort of starting to get into more clinical behaviors, clinical opportunities, do you think could be moved outside of a traditional clinical setting? Yes, but I think that the quote-unquote AI, we think about it almost like software, is not enough. And but I think with also the development of hardware, real-time monitoring, I mean, we've seen with the CGM, the continuous glucose monitoring, what it does is, from a clinician standpoint, then we know whether you have high sugar, low sugar, rather than having an everyday finger prick, which is hugely inaccurate if you think about it, or every 3 months we do HbA1c on your average, again, hugely inaccurate. But the benefits is not in you have a lot of data. I think the benefit is if the patient themselves see those data, they can have a better understanding of their own health. They get a better understanding, if I eat this type of food, my sugar goes up a lot higher. Oh, I feel tired because of this. Now, I take my insulin, I take my diabetes medication, right? This is how fast my sugar will drop back to normal. Oh, I took too much, that's why I was feeling dizzy. This is my sugar levels. I think it's the nature of not only the hardware and the sensing technology will give you the data, but then I think the AI will also help you interpret so that you have a much better understanding of yourself. I think now a lot of people, why they like the Oura Ring,
again, is because of the close connectivity of the ability to look at your own data. Now, and I think this is where AI alone is not enough. You need to actually couple that with a lot of technological innovation, right, in order to fulfill it. Now, then the next question is, when you visit your next physician for your diabetes follow-up, right, more holistically, right, then the question is, how can the health system or the physician also be in sync with you, with the understanding of what you have, with the data that you have? Because if the health system and your care provider is not in sync, you will start to feel like that you don't understand the way that I do, because you're not making your professional judgment based on sort of my longitudinal data. And I think this is where the AI has a huge role, right, in terms of compressing and understanding so that the health system can also absorb that information.
Yeah, and I think we hear about decentralized care or care in other settings with implications on the patient side and many of these behavioral pieces and having all of this data and the ability to make meaning from it, but also on the physician side or the nurse side. Can you say more about the role of AI to empower and expand the capabilities of our healthcare workers, kind of to this notion of we will never have enough doctors and nurses? Is AI going to help us solve that?
Yeah, again, I think AI is the one tool in the toolbox. Let me give you an example in China. WeChat is widely being used, right? It's made by Tencent. And we have an enterprise version of WeChat called WeCom, right? You can think about it as WhatsApp for business, right? That organization clinics that they use, right? For data protection reasons. And it's very, very common for primary care physicians in China to sign contracts, similar to the NHS, right, to sign contracts with the patients. And rather than just booking the appointment, a lot of those patients ask these primary care giver, right, a lot of questions, right, sometimes about health, sometimes about the diseases. Now, and only if it's necessary, then they come offline to actually see them. Now, when you have that, that means the doctor needs to be quote-unquote on call 24/7, which is quite hard. And I think this is where AI is hugely supportive, right, of being able to give the most appropriate personalized answer that is validated by the clinician, right? And so there are different layers that we design, right? Some of the administrative, and when is your clinic opening? Do you have a room, right? That the AI can automatically answer, right? The health check one, right? It's like, oh, is it okay to eat this, right? Like those things, if they choose to, the AI can automatically reply. Some of the more serious ones, the AI will usually generate an answer and wait for the healthcare provider to accept before sending it out. And so there are different layers, and I think that the framework which we're trying to propagate and is still in development is that there's a lot of local practices that no AI will ever be able to know. Right? These are quirks and nuances, right? Even in China, the practices in different cities, Northeast, Southeast, might be very different, let alone different countries we're working on. And can we develop an AI, almost like what we call a designable AI, so that you can embed a lot of the local nuances on how you do things, right? So that the doctor feels like that it's not just one generic God AI that rules them all, but then is tailored to your local setting, your local situation. Now, when tech company hears that, we get really worried because that means we can't scale. Now, so I'm rethinking another framework of, well, can you actually meet both sides, right, to actually enable that? Because I think it's only when we actually have something like this, then we actually solve a lot of the healthcare worker issue on how to actually have the AI that they can trust and use.
Which brings up a question that a lot of people ask around safety and accountability and liability. When you think about both sides and the role of AI informing or proposing a solution that a doctor can approve, or the AI providing a lot of support to the patients, what does that imply for the accountability in the system and the liability risk, I guess, when things go wrong?
Yep. I think these two are accountability and liability. When people think accountability, right, people think that you should think about the negative side of it. if something goes wrong and you're accountable, that means you're liable. But that's why I said right at the first set, I think we need to reimagine a very, very different healthcare system where if we can get to a stage where the patients feel more empowered with everything we just said, right? They should be the number one accountable for their own health and not the healthcare system. Because the healthcare system has been designed in a way it needs to change. Now, I think there's certain accountability that has to sit still with the healthcare system, such as making the final diagnosis, right? Making the prescription, having be able to follow up, right? I think that accountability will not change just because of AI. And the technology, I always feel like that should not be the front and center. To me, AI technology, I see it as any other technology. There are areas where it should be regulated, and there are areas where it shouldn't be regulated. And the lines are very, very clear. But now, unfortunately, for all of us sitting right here, right now, at this point in time, I don't think the regulator naturally, right, is responding to the speed at which the public demands and the health system wants to change.
Agreed. Regulators and speed are not things that you have in the same sentence most of the time. I'm going to ask another question before I open it up for all of you to ask questions. And that is around equity in the system. And we've already seen tremendous inequities that have always been in place, and many of our speakers in the last set of sessions were talking about trying to close some of these equity gaps. In this case, without intentional design, we run the risk of further broadening the gap between those who are getting the best healthcare in the world and those who are still not able to meet their most basic healthcare needs. What does it mean as we think about scaling these models to close the health equity gap as opposed to make it more pronounced?
I think this is where I sort of merge all my previous experience into the way that I try to think about this in my role at Tencent right now. My personal experience is we have inequality in resource allocation everywhere. You see more in the cities, more in the rich countries, right? As you go to, even within China, you go to the western part and the rural part, right? You get less economic development, and you get less well-trained doctors. You get less specialists, right? And your ratios are not good for doctors per population. Now, the good thing is, doctors are, by and large, and I can say it because I was one, right? Are quite arrogant. Especially the one in the big cities and big centers. They still like to think that they are the best, and no AI can actually beat them. They are the gold standard. So all the AI is to do is measure how close they are to me as a gold standard. So AI is not going to help them all that much, which is true. Maybe on very, very specific use cases, the AI can help, but then if you go to the rural areas, I think the folks there are a lot more humble and a lot more receptive in terms of readily adopting the help from AI. So I think that hubris inherently lends itself as to close the gap, because the humbleness of the rural village doctors, right, using it, this is great, and the public is using it, and it's great. But now that, I think that is only to start, and I think the true inequality, as we see as a movie out play with, right, is not how you design it, it's actually how it evolves. I don't think any healthcare system architecture, even the likes of the NHS building up from post-war ground up, right, design it to be inequitable. I don't think in any planner's mind that's what they're in. But why it becomes inequitable is usually the incentives, the measurement system that keeps nudging resources to be more concentrated, right? It keeps nudging patients with the haves, right, to get more priority. And the ones living further away because of access to transportation, access to appointments, because they have a day job, they cannot take a day off because otherwise they won't actually make money that day, and they need money for food, right? It's those systematic issues that draws the system apart. Now, and which I think, so at the start, I don't think AI will necessarily make the big divide. Now I'm going to basically correct what I say, because I'm saying it with my very, very close observation in China, where the whole population has electricity and 5G connectivity, and most people has a smartphone that can access the AI. Now, if you broaden it to global level, where electrification, connectivity, and mobile phones is still a rarity in parts of the population, then you have the issue, right? I think but then interesting, the issue is not the AI, it's all the infrastructure that we just spoke about.
Yeah, all those enabling conditions. Who would like the first audience question? Yes, in the white sweater. Let me bring you a microphone. Do we have another one?
I'm loud enough, I guess.
Okay.
Thanks for the insights. I just wanted to understand when you talk about making patients more accountable, how do you address the healthcare inequities as well as also making patients? Because I guess there's a gap in education, because it won't be like a one-size-fits-all. All patients may not have the right information or understanding, have that kind of accountability. So I just wanted to know how you would address that.
The way I think about it is, I think if you ask everyone, I think we are ultimately has to be accountable for our own health, right? I think your question goes to, well, how are they being more equipped, right, to be more accountable for it, right? I think this is where the start of this AI revolution has an original sin. The original sin is it is a chatbot, and the chatbot will only respond when you ask a question. What you ask the wrong question, it's giving you not the right answer, right? And I think that's the original sin of this current generation of AI, and that's why I with the people we were talking about this, they were explaining this whole uncle concept. Where it's like, can we have someone actually an AI that behaves in a very, very different manner, where it comes out and check on you once in a while, right? And use that as a lead way to then start talking or transmitting or feeding, right, the right information, right, that will actually help you make more informed choices. I think this is when the accountability really fits in, right, to what we were just talking about. So I don't have a good answer for you. This is something I've been thinking about quite a lot, because we've all been trained to, the last 3 years, right, to act in a certain way with the different apps. Right? But then what you're talking about as empowering accountability is actually the flip of the reverse. But you don't want to do it so paternalistically, right, that we force in the same trap as before, that people are not internalizing it and become too reliant, right, on the advice, which we know is not foolproof.
Thanks.
And I love that brings us back to your opening point about mental models. And there are sort of some first principle things, right? We know smoking is probably going to lead you to lung cancer. If you choose to smoke, you're accountable for the fact that you've got lung cancer. So there are those behavioral choices where that first person accountability will not be solved by AI or any other tech that comes down the road. Who else has a question for Alex? Oh, all the way in the back, or right behind you.
I'm a lifestyle coach, and what about prevention? The important thing is health is not a goal, it's a lifestyle. And there are so many initiatives and apps, and you can't miss anything, but we have to take responsibility and action. And how can AI help us to get people in action and do the right things, so the right healthy lifestyle habits implemented in their own life, in their own daily, weekly life?
I think this is an area that we're only barely scratching the surface. And that's, to me, that's why I said, right, that I believe is actually the biggest value that AI can bring. Now, AI alone will not solve it, because I think a lot of our our habits of what we eat, how we exercise, the choices that we make, right? It is inherent in itself because we're all, I'm lazy, right? If I can be, but then what are then the positive signals and nudges and drives, right? That will enable me to live a healthier, preventive life. I think that is the key, and I'm not even talking about the prevention like vaccinations, right? I think those we have ways to come about, right? It's about healthy living, healthy exercise, right? Those things are hard, but I think this is where I've seen a few experiments. I'm not too convinced that there's a working model yet because we are all very, very different. Now, the good thing is, I think there's enough experts out there on behavioral economics, right? On how to make certain nudges work, but I do see two gaps. One is business models. I don't see a clear business model of people willing to pay for services or integrated services, right, for their own good. But having said that, you do see one of the biggest booming market is in vitamins and supplements. Right? It's not an AI. And I would say that Oura Ring is actually in that category of vitamins and supplements, right? So the will is there, but I just don't think that even the community of innovators has cracked the code, right, on how to merge, right, with the power of AI right now, with the behavioral economics into a business model that people are willing to pay for to make them healthier in a way that they are comfortable with. There are many apps out there to tell you not to eat fast food, right? Can you imagine that I go to McDonald's, I get a very fatty burger. Then I take a picture of it, right, and tells me it's got high fat, high cholesterol, high sugar, it's processed meat, right, the cook is bad. But I already bought it. Otherwise, I can't take a picture of it, right? And I'm going to eat it no matter what. It's a record, right? It doesn't do this pre-cog thing, right, to influence me a bit more subconsciously, right? Not to even make that purchasing decision before it happens.
I'm going to retain prerogative for the last question, and that is to say, what is the one thing you'd want to change if you had a magic wand, a policy or business model that would help us scale the promise of AI within some of the guardrails you've laid out?
I do have one wish, but I'm not sure whether it will ever be fulfilled. I
have lots of wishes that'll probably never be fulfilled.
When it comes to adopting AI, when I was talking about redesigning the process, right? And this is in the context of my previous comment about inequality is not, it doesn't happen by design, it happened because of evolution. I wish there would be a commonly agreed open standards with all the compliance in check that allows a lot of people to continue to evaluate the progress of usage of AI along all walks of healthcare, where there's actually independent prevention to co-piloting with nurses and physicians to even the big hospitals. Because I think where a lot of the initiatives that we are initiating right now is based on gut feel, based on instinct. It's not that data-driven. And I think this is where, if there's a system of which way we can continuously monitor, and with AI, I think now, with the data stream, we can finally, without doing a proper study, right? And we know the results 3 years later. Now we actually can know in much more real time whether this AI, this approach is actually working better and delivering better operational result, better outcome for patients, right? Better NPS scores, right? I think this is where my dream is, because the dream is not just the design. The dream is that there will be a system of continuous improvement, right, to monitor in AI for us to then keep on changing the way that we use technology. And that to me has always been the goal, because this is where then we know that, we start to see inequality creeping in. We can go back and then fix it, rather than, 30 years later, oops, we underinvested in this area and it's too late.
Thank you. Please join me in thanking Alex for being part of our afternoon.